a weekly discussion about the federal issues most important to Nevada. And now, from Washington, D.C., here's Marilee Joyce.
Well, good day to you. I'm Marilee Joyce. This is Eye on Washington, the only statewide Nevada news program produced in Washington, D.C. Every week, Eye on Washington takes you straight to Capitol Hill for a discussion with Nevada's delegation and other leaders about the federal matters that matter to you. Today's topic, the doctor is in, and he has plenty to say about health care reform. We'll tell you one Nevada congressman's thoughts on the big health care bill that passed last year, and of course, he is my guest today, Nevada U.S. Congressman Joe Heck. Thanks for being here today.
Thanks, Marilee. Good to be back.
Now, when it comes to health care reform, most folks in and out of Congress seem to agree that health care in this country could be improved, but that's where the agreements seem to end. And today on Eye on Washington, we'll tell you what the passed bill is and how it's funded. We'll tell you what the bill means to you in Nevada, and of course, we'll learn whether Congressman and Dr. Joe Heck says keep it, scrap it, or tweak it, and why. The Patient Protection and Affordable Care Act, which was signed into law by the President last March, seeks to extend health care to millions of Americans who currently are uninsured and includes sweeping changes to the nation's health care delivery system. Let's look at its immediate provisions and a few that will take effect in coming years. An end to insurance policy denial for those with pre-existing conditions. Kids right away, adults beginning in 2014. Small business tax credits. Those with fewer than 50 employees get credits covering up to 50% of employee premiums. Adults up to age 27 get continued coverage under parents' plans. A rebate to fill the donut hole in Medicare drug coverage. 50% will be filled starting this year. Lifetime caps, limited now, banned in 2014. By 2018, new plans must cover checkups and preventative care without copays and end of rescissions. That means your insurance cannot cut you off if you get sick. And there's more, Congressman. There is enhanced fraud abuse checks, customer appeal process, restaurant nutrition content disclosure, etc. But what I got to were the biggies. And before I get to kind of going over some of those points with you, as a medical doctor and a former business owner, you ran a medical training services company, in fact. Do you believe you bring special experience and knowledge to this issue?
Well, I believe I do. I mean, not just as a practicing physician, taking care of people in the emergency department, which is where I worked, on the front lines of healthcare. Sure. The only place where you take care of everyone regardless of time of day, ability to pay, or whatever their chief complaint is. But I've also worked as an educator in the medical school, and I've also worked as an administrator in hospitals. And then, having been a small business owner trying to provide benefits, I think I bring that expertise to the table in the discussion on this bill.
Well, let's get right to your personal opinion. What do you like and dislike about the bill?
Well, you know, I've always talked about the bill in a matter of repeal, repair, replace. I mean, I think there are certainly things within the bill that have merit and that we need to try to keep and perhaps make a little bit better at providing patient-centered solutions so that people have better access to more affordable health care. Certainly a lot of the insurance reforms have merit.
I think you told the Washington Post about the pre-existing conditions.
Pre-existing conditions. I believe personally that anybody who wants to be able to purchase an insurance policy should have the ability to get that insurance policy regardless of pre-existing condition. Likewise, I believe that someone shouldn't be dropped from their policy the day after they become ill. And I do also support getting rid of annual or lifetime caps. Those are some of the insurance reforms that I think are worth keeping. The problem when you look at the bill in totality are there are many things in the bill that have absolutely nothing to do with health care, which add costs to the overall bill and add burdens to business owners in trying to meet. Well, you mentioned one with the restaurant nutrition bill provision. Not that it may not be an important issue for many, but what that requires is that once you have 20 or more outlets in your restaurant chain, you have to nutritionally label all the items on your menu. There you may have somebody who's at outlet number 19, looking to expand to outlet number 20, create jobs for Southern Nevada, which we desperately need, but now may rethink that because of the cost involved once they hit that number 20 store threshold and what's going to happen with their nutritional labeling. Sure. And I think the free market drives that. If somebody's interested in going to a restaurant that provides that information, they should have that option. It shouldn't be something that's mandated.
Let's look at a couple of these. What about the keeping adult kids on the parents' health insurance through age 27?
I support keeping a dependent child on the insurance policy till age it's 26. It would expire by age 27. This bill allows any child up to age 26 or through age 26, even if the child is married and lives in another state, to stay on the parent's insurance policy. And so I think if the child is just starting out, living at home, still in school up to age 26, that option should be there. But I don't believe that a child, or not actually a child, but someone who's now 26 years old, married, a family of their own, should remain on their parent's insurance policy.
You know, how about that, the small business tax credit? I want to look at this specifically. The Department of Health, I have here that small businesses pay an average of 18% more than large companies for the same coverage. So is the tax credit a good idea?
Well, the issue with the tax credit is that it phases out very rapidly. It starts at 10 employees, phases out by the time you hit 25. Mm-hmm. It's also based on what your average wage is. It starts phasing out once you start paying somebody more than $25,000 a year. So there's kind of a catch-22 in that if you want to provide a higher wage, you're going to lose the tax credit. I think a better approach is to allow small businesses to come together as guarantee associations and be able to have the same purchasing power to buy policies as large corporations do, and let them be able to come together, buy the policies that are best for them, and give them the tax credit.
As we're wrapping up here in this segment, I do want to touch on the Medicare donut hole. This bill, it's a 50% rebate to close the donut hole. What are your thoughts on that?
Well, it provides a 50% discount on brand name pharmaceuticals for those in the donut hole. The fact is, many seniors at this point in time are on generic drugs. It doesn't apply to generic drugs. And to pay for that closing of the donut hole, it actually raises the Part D premiums for all seniors. So you're going to have all seniors paying a higher premium to offset the 50% cost reduction on brand name drugs for those in the donut hole. And again, I think there's more cost-effective ways to bring down the cost of pharmaceuticals for our seniors.
We're going to get to a lot more next, including that $1 trillion-plus price tag, and find out what my congressman guest thinks of that when Eye on Washington returns.
You're watching Eye on Washington with Marilee Joyce. Brought to you by the Southern Nevada Water Authority, the National Mining Association, the Frias Companies, Caesars Entertainment, NV Energy, the Las Vegas Convention and Visitors Authority, and SKYLINE Restaurant and Casino.
Sunrise, the Mojave Desert. Just another day in Southern Nevada? Think again, pal. Millions of concerned citizens are throwing in to conserve water. Yes, from the welcoming hills of Boulder City to the friendly streets of Spring Valley, everyone's playing their part. Way to go, Joe. It's a desert out there. Be water smart. Go to snwa.com.
Eye on Washington with Marilee Joyce, Nevada's only statewide program produced in Washington, D.C., is your weekly update on the top federal issues that are most important to Nevadans. But for even more news from Capitol Hill that affects you, your family, and your business, you need to read Nevada's Washington Watch, our online newsletter. In-depth reporting on federal efforts that impact you. Our exclusive Inside the Beltway column that puts a microscope on Nevada's Congressional Delegation. Guest editorials from industry and business leaders about what Nevada needs from the Hill. Nevada's Washington Watch, your watch on Washington. Subscribe today at nevadaswashingtonwatch.com.
Heads we go, tails we stay. A coin flip. That's how it all began for what is now Nevada's largest transportation provider. Charlie Frias, with a can-do spirit and support of his loving wife Phyllis, bought ABC Union Cab in 1966. They then parlayed 5 cabs into a fleet of nearly 1,000. And today, Frias has over 2,000 employees and was recently voted Las Vegas's best company to work for. Frias, safe, reliable, simply the best.
America's minerals have made us a nation of self-reliant dreamers, shaping our world and the endless ways we enjoy it. But red tape often forces us to import more than half the minerals we depend on. Minerals we already have. We don't import our dreams. Shouldn't that go for our minerals, too? The National Mining Association. Learn more at nma.org.
Welcome back to Eye on Washington, our discussion about the health care reform bill. My guest today is Nevada U.S. Congressman and Dr. Joe Heck. Let's get now to the funding. Exact figures are hard to find, but whitehouse.gov mentions that $1 trillion-plus price tag, so we're going to go with that. The Act's provisions are intended to be funded by a variety of taxes and offsets. The Joint Committee on Taxation estimated last March that they'd take effect over the next 4 years and total a new tax revenue estimated to be in the amount of $409.2 billion over the next 10 years. The committee estimated $78 billion would be realized before the end of fiscal year 2014. Now, officials say major sources of new revenue are a much broadened Medicare tax on incomes higher than $200,000 and $250,000 for individual and joint filers, respectively, an annual fee on insurance providers, and a 40% tax on so-called Cadillac insurance policies. Those are plans that cost a bit more than $10,000 for individuals and $37,500 for families. There also are notable taxes on pharmaceuticals, high-cost diagnostic equipment, and a federal sales tax on indoor tanning services. Offsets are from intended cost savings, such as improvements in the Medicare Advantage program relative to traditional Medicare. And a little trivia for you, the indoor tanning services tax, which starts this July, actually replaced a proposed tax on cosmetic surgery. So anyway, I guess with that tax on the tanning beds, everyone's going to be as pale as Marilee pretty soon because can't afford that. But anyway, this is from the White House site. Quote, the majority of initiatives that would pay for reform will come from cutting waste, fraud, and abuse within existing government health programs, ending big subsidies to insurance companies, and increasing efficiency with such steps as coordinating care and streamlining paperwork. Well, let's look at these. Cutting waste, fraud, and abuse in government health programs. Sounds good.
It sure does. And the fact is, we have the ability to do that without a 2,700-page healthcare reform bill. There have been multiple laws passed and multiple different programs put into place to try to decrease fraud, waste, and abuse in the Medicaid and Medicare programs. And by all means, we need to embrace those and expand those. That's not the issue. The issue is the fact that we're collecting 10 years of taxes to pay for 6 years of benefits, the way the bill is originally rolled out. We're looking at taking $500 million away from Medicare, phasing out Medicare Advantage, which would directly affect almost 100,000 seniors in Clark County who are Medicare Advantage enrollees, people that are very happy with their plans because they provide more comprehensive services than traditional Medicare. You mentioned the tanning tax. I mean, what is the nexus behind taxing someone who's going to use a tanning salon and trying to offset the cost of health care? As you mentioned, the plastic surgery tax, the so-called BOE tax, was taken out and was replaced with this. And I think when you look at who actually pays taxes, it's not the pharmaceutical industry, it's not the medical device manufacturer, it's the consumer who ultimately is going to bear the cost for that tax as that tax is added in to the cost of the goods or service.
You know, here's another thing that the White House site says the bill cuts. I want your opinion on this. The quote is, it cuts unwarranted subsidies to the insurance industry over 10 years. How is a big amount defined, if you know?
Well, I'm not sure.
What's unwarranted? What does that mean?
I'm not sure what they're referring to when it talks about subsidies. I believe it's when they're referring to the Medicare Advantage program, in which there is a higher payment to Medicare Advantage insurers under those plans than traditional Medicare. But again, Medicare Advantage provides much more comprehensive services. It provides preventive medicine services in many places, provides dental, vision, comprehensive health care with a primary care provider. And so there may be a little bit more upfront cost. But research shows that in the long run, people on Medicare Advantage actually have less hospital days than those on traditional Medicare.
You know, I do want to know, in your opinion, how do taxation officials get that revenue figure? The figure they have is $409 billion over 10 years. How are these estimated? Well,
there's a lot of accounting gimmickry in the bill, and that's how they were able to initially bring the cost in at $1 trillion, which is what the number was arbitrarily set at in order to garner enough support for passage. Interestingly, about 2 to 3 months after the bill passed, the Congressional Budget Office came back and said, oh, it's actually going to be $1.2 trillion. And so they look at the taxes that are being added in. Again, there's taxes on pharmaceuticals, medical device manufacturers, the tanning tax, looking at what the expected outlays will be to provide the expanded services. They talk about free preventive medicine services. There are no free services. Someone's going to be paying the cost of that either in their insurance policy or in a higher cost of receiving other services.
You know, quickly, I've read reports about actions taken by insurance companies who are worried about what they say are going to be the high costs they're going to bear under this bill. And one example was a news piece in Ventura, California paper. It said that Blue Shield of California says it intends to raise rates up to 59%, affecting 200,000 customers, and the company is blaming the rising expenses due to this bill.
Without a doubt. Also, one of the things within the bill is what's called rate banding, where there's actually rate setting provided by the federal government. And so what you would expect is some insurance plans, prior to those rate bans, that rate fixing coming into effect, are going to raise their premiums to try to offset that before they're subjected to this type of regulation.
Okay, when we come back, what you want to know, what does this bill mean to you in Nevada? We'll have that right after this.
Sunrise. The Mojave Desert. Just another day in southern Nevada? Think again, pal. Millions of concerned citizens are throwing in to conserve water. Yes, from those hipsters in Henderson to those frolicking families around Lone Mountain, everyone's playing their part. Nice frolicking. It's a desert out there. Be water smart. Go to snwa.com.
Every day, thousands of people in northern Nevada don't get enough to eat. 1 out of 5 children in northern Nevada go to bed hungry every night. But you can do something about it. Catholic Community Services of Northern Nevada has been providing help and creating hope in our community for more than 65 years. By donating food, time, or money, you can make a difference in a hungry person's life. When you make your generous donation to St. Vincent's Dining Room and St. Vincent's Food Pantry, you're helping to fight the scourge of hunger in northern Nevada. In these tough economic times, now more than ever, we need to help those less fortunate. To find out how you can donate to St. Vincent's Dining Room and St. Vincent's Food Pantry, call, click, or stop by, and together we can end hunger in northern Nevada.
How will new energy technology make our lives better? Will geothermal, wind, and solar energy be a bigger part of our future? Yes. And soon it will all be in our backyard. Learn more at nvenergy.com.
You already watch Eye on Washington with Marilee Joyce, Nevada's only statewide program produced in Washington, D.C. But for even more news from Capitol Hill that affects you, your family, and your business, you need to read Nevada's Washington Watch, our online newsletter. In-depth reporting on federal efforts that impact you. Our exclusive Inside the Beltway column, putting a microscope on Nevada's Congressional Delegation. Guest editorials about what Nevada needs from the Hill. Nevada's Washington Watch, your watch on Washington. Subscribe today at nevadaswashingtonwatch.com.
Thanks to an ongoing commitment by America's mining companies, more than 2 million acres already have been reclaimed. To learn more about reclamation or other aspects of mining, visit nma.org, the National Mining Association.
And welcome back to Eye on Washington, our discussion of the health care reform legislation. We've been visiting with Nevada U.S. Congressman Joe Heck. Let's look now at what this bill means to you in Nevada. This all is according to the U.S. Department of Health and Human Services website section on the bill regarding immediate provisions for Nevada. These are Nevada specifics of some of the bill provisions outlined earlier in the show. About 30,000 Nevada small businesses will get those small business tax credits. An estimated 28,000 Nevadans will be affected by the closing of that Medicare Part D donut hole, those who've hit a one-time $250 rebate this year. 38,000 or so residents who retired before being eligible for Medicare and who have health coverage through former employers will get health coverage support. That extension of coverage under your parents' plans affects about 9,400 of you. Additional provisions involve what the department calls consumer protections, and they all involve insurance companies. The 1.5 million Nevadans with private insurance can't be given lifetime limits on their coverage. Like elsewhere, you can't be dropped for pre-existing conditions, and if you get sick, you cannot be dropped from your plan. Insurance plans, quote, will be tightly regulated to ensure access to needed care. The department says this affects 1.4 million Nevadans with employer-provided health care, as well as those who anyone who signs up for a new insurance plan in Nevada. And any health insurers offering new plans have to develop an appeals process to make it easy for enrollees to dispute a denial of a medical claim. And Congressman, there's some other things again: protecting patients' choice of doctors, new federal Medicaid funding option, community health care funding. But I wanted to expand on the biggies again. Your thoughts on the provisions for Nevada?
Well, again, those provisions that will truly increase access to health insurance and provide those consumer protections like taking away pre-existing condition exclusions, lifetime maximums, and rights of rescission are being dropped after you become ill are critically important. But let's not forget that over 65% of the people receive their health insurance through their employer. And if we got more people back to work, we'd have more people be able to receive insurance in the more traditional manner. Not that we don't need options for those that are unemployed or where it's not offered through their workplace. But when you look at the almost $700 billion worth of taxes that come out of this bill, it's going to significantly impact small businesses' ability to be able to grow their business and hire the next employee. Everything that takes $1 away from a business's bottom line is one less dollar to hire that next employee or give a pay raise. And so we're in this catch-22. Certainly, we need options for people that don't have access through insurance from their employer. But Medicaid expansion is certainly one option, but that's going to put a huge unfunded mandate onto the state. And there is some increased matching dollars for the first couple years, but after that, the state is left holding the bag. Same thing with the small business tax credit. That phases out after a couple years.
Well, and that small business tax credit, we mentioned before how the health department says that the small businesses pay on average 18% more than large businesses for the same coverage. We should also say that health premiums have gone up 3 times faster than wages in the past 10 years. So the provision makes coverage more affordable for Nevada small businesses, many of which are struggling in the economy, or not?
Well, I don't believe so, because the bill does very little to help curtail the spiraling cost of health care, which is the critical factor. We can offer insurance to people. Which is felt
more by small businesses than large companies.
That's one of the reasons why their premiums are higher, because they have a smaller risk pool based on the number of employees they have. That risk is spread amongst fewer people, increased premiums, higher cost of health care. So if we truly want to increase access to more affordable health care, we have to be very diligent in trying to bring down the overall costs of health care for everyone.
The state is getting $61.1 million toward that pre-existing conditions provisions, and this is divided among insurers, and how is that allotment decided?
Well, that's part of the stopgap measure of the high-risk pool, which is to allow people who currently are uninsured due to a pre-existing condition to have some type of insurance until 2014, when the new health exchange system is supposed to be in effect. That high-risk insurance pool has been woefully undersubscribed. Very few people are taking advantage of it because there is still a high cost to the premium. And when you look at the requirement, you have to be uninsured for 6 months, have a pre-existing condition to be eligible for that program.
In the 20 seconds we have left, I've asked you, tweak it, kill it, keep it. If you, what's the, I know we don't have time for what the perfect bill is, but what would you definitely get rid of and what would you definitely keep?
I would
Give
get
me
rid
a couple of each.
I'd get rid of all the burdensome taxes. I would keep the insurance protections, and I would also take out the things that have nothing to do with health care but were placed in there as pet projects.
Okay, we're going to have our mailbag segment right after this.
Sunrise, the Mojave Desert. Just another day in southern Nevada? Think again, pal. Millions of concerned citizens are throwing in to conserve water. Yes, from the sunny folks at Sunrise Mountain to our pals out in Red Rock. Everyone's playing their part. Saving water is fun? I'll say, it's a desert out there. Be water smart. Go to snwa.com.
All of us at Caesars Entertainment have something we want to say.
Play responsibly.
Play responsibly.
We don't want you to gamble if you've had too much to drink.
You shouldn't gamble if you're lonely or depressed.
And if you're under 21, you're not allowed to play.
No.
No matter which of our casinos you come to, our message is always the same.
Play responsibly.
Play responsibly.
Play responsibly. We know you're coming to our casinos to have a good time, and we always want you to leave feeling like you did.
Built on a fleet of just 5 cabs bought in 1966 by founder Charlie Frias, Frias Transportation is now Nevada's largest transportation provider. Today, Frias has a fleet of nearly 1,000 vehicles and more than 2,000 employees. As an industry and community leader, Frias continues to create the future of transportation technology and management and actively supports the community, continuing the legacy of quality service in the Las Vegas Valley. Simply the best. Thanks to an ongoing commitment by America's mining companies, more than 2 million acres already have been reclaimed. To learn more about reclamation or other aspects of mining, visit nma.org, the National Mining Association.
Sunrise. The Mojave Desert. Just another day in southern Nevada? Think again, pal. Millions of concerned citizens are throwing in to conserve water. Guests from those hipsters in Henderson to those frolicking families around Lone Mountain, everyone's playing their part. Nice frolicking. It's a desert out there. Be water smart. Go to snwa.com.
And we are back with our closing segment of Eye on Washington. It's our mailbag segment. In this segment, we tell you about an issue the congressional guests are receiving a lot of correspondence about. We read one of your letters on the air, and we invite our guests to respond to you right here. And Congressman, your office has already been hearing a lot about education, and I have a letter here from Nelson B. of Henderson. He writes, "Dear Congressman Heck, Nevada's education system is woefully behind the rest of the nation, but as a teacher, I can vouch for the talent in our classrooms. What can be done to improve Nevada's education system and the quality of graduates that we produce?" How do you respond to Nelson?
Yeah, Nelson, that's a great question. Certainly, we need to do more to make sure that we have students that are able to compete globally upon graduation. And I think there are two critical things that we need to address. One is increased options for parents. It's the parents' responsibility to make sure that their child gets the education they need to be successful. And to do that, they need options, whether it's public school, private school, charter school, homeschooling. We need to encourage them and give them the tools and resources they need so that they can ensure their child gets the education that that child is going to require. In addition, I think we need to get back to the basics. We have to concentrate on reading, writing, and arithmetic. Not that the arts or sports, extracurricular activities aren't important, but to be globally competitive, we need to concentrate on those science, technology, engineering, and math programs. We have students that can't write a cogent paragraph, can't speak a full sentence, or can't make change without the cash register telling them how much money they need to give back. So we got to get back to the basics, and we've got to give parents choice.
You're on the Education and Labor Committee in the House. What is the role of the federal government in education?
I think the role of the federal government should be somewhat limited, primarily looking at Title I, Title IX programs, making sure there's no discrimination, equal access. But other than that, education should be left to the states and should be left to the local communities.
Okay, we got healthcare and education well covered in the show. Thanks so much for being here, and we'll see you again soon. That does wrap up this week's Eye on Washington. Be sure to join us next time as we discuss more important federal matters and their impact on you in Nevada. And for news anytime on how federal issues affect you, visit our website, joycecommunications.com. I'm Marilee, Joyce in Washington. Good day.